You're never told that life could ever get this way. Maybe you did find something suspicious, or you would just like to make sure you have a clean bill of health. So now it's time to talk to you about 10 things to consider when weighing your risks and your benefits of breast imaging.
Consideration number 1, breast imaging doesn't prevent breast cancer, but it does reduce the incidence of death from breast cancer.
I'm going to start out with talking to you about breast density because that makes a huge difference in the success of your imaging. And then I'm going to talk about mammograms and ultrasounds. And last, I want to talk about something that's been new coming along the scene, thermography.
Consideration number 2, as always, get any suspicion checked out regardless.
So I'm going to tell you a little bit about my personal breast cancer journey when it comes to breast imaging. I had one mammogram before I found the suspicious spot and had that additional mammogram that led to a stage 3 breast cancer diagnosis. I was only about 33 years old, and they didn't find anything that they thought was concerning at the time. But the oncologist thinks that the tumor was there for about 10 years by the time it was discovered. And guess how old I was? 43. This means that the breast cancer was either there, but really, really well hidden, or it was really tiny. Either way, breast density is a very important topic to consider in my breast cancer journey, and for many women who are under the age of 40. This is why I can't stress enough how important it is for you to be your very own best advocate. Do not let a physician, a radiologist, or any medical provider brush you off when you have a concern. My tumor that I had was 7.5 centimeters by the time it was discovered, but it was considered slow growing. So I tend to agree with the oncologist. How could something be slow growing and be 7.5 centimeters, but it wasn't there on that first mammogram?
Consideration number 4, breast density is an issue to address.
Now, before I get too far ahead, I want to let you know that I am not upset with the radiologists of the first mammogram that I had, because at the time they didn't know a lot about breast density and how it relates to late stage breast cancer. They were just getting to know a little bit about it and didn't have a lot of technology. There's an author, her name is Geraldine Lucas. She wrote the book, Why I Wore Lipstick to My Mastectomy. She herself is a breast cancer survivor. She was diagnosed at 27 years old. Her cousin also had breast cancer. I believe she was diagnosed at 39. She did not survive her breast cancer, and it has been determined that she had dense breasts, and so they didn't pick up on it on time. In fact, there was a bill passed in New York because of her cousin, and it required physicians that were involved in screening for breast cancer to do more diagnostics for women who had and have dense breast tissue. Because of the technology that's been developed since then, over 11,000 women under the age of 40 are diagnosed each year. That might sound like a scary statistic, but it's good news because it means that we are picking up on breast cancer at an earlier stage. And when we catch it at an earlier stage, you have a better prognosis. So breast density is a big deal because if you have dense breasts, it's harder for mammograms to pick up on tiny tumors. They hide behind dense breast tissue. What exactly is breast density? Breast density is officially called the relative proportion of fatty tissue versus the granular fibrous tissues when viewed on a mammogram. So it means that the fatty tissue appears black, while the milk glands and fibrous tissue appear white. If you have dense breast tissue, the milk glands or fibrous tissue is higher in proportion to the black fatty tissue. This means that the wider your mammogram is, the denser your breasts are, and the more likely that something could be hiding behind the density showing up in the mammogram. Radiologists, whose job it is to read mammograms, use the term breast density to describe breasts that are hard to see through and hard to detect tumors through. 30 to 40% of women have breast density issues.
Use this analogy to visualize breast density. If you have low breast density, it is like looking through a glass to look for tumors. If you have high breast density, it is like looking through a brick to look for tumors.
Breast density is more common in women in their 40s and less common in women from 50 to 70 years old. In general, women tend to lose breast density the older they get. Radiologists use a scoring system to categorize breast density. They use a scale from 1 to 4, with 1 being low to no density and 4 being high density. Mammograms can still detect breast cancer, but they're not as accurate at detecting tumors in women with high density. 2 things that have changed since I had that first mammogram when I was 33 years old are 3D mammograms and automated whole breast ultrasounds. 2D mammograms are available almost everywhere, but 3D mammograms aren't. So you will have to discuss this with your physician and make sure that they send an order for a 3D mammogram if you believe that you may have high density breast tissue. 3D mammograms are done specifically for women with higher breast density. They take images from more angles than a 2D mammogram. 3D mammograms usually mean that you have fewer follow-up screenings, which means that you don't spend as much money on your medical care, which also means that you take up less time on your calendar for doctor appointments. But more importantly, if something is found, it catches it earlier, which means that you have a much better diagnosis and a much lower stage. A typical ultrasound images the breast to find and determine if the breast has a lump or a cyst. But an automated whole breast ultrasound uses a pad and it's placed on the breast, and the ultrasound scans the entire breast to create a 3D image. And this allows the radiologist to compare that to the mammogram and previous mammograms before that to determine if there are any new growths. Automated whole breast ultrasounds aren't as widely and readily available compared to 3D mammograms, but it still wouldn't hurt to ask your physician if they can order you one, because it can make a huge difference, up to 50%. It can increase your chance of detecting smaller tumors and detecting breast cancer earlier by up to 50%, and that is a huge game changer. Now that you know what breast density is, I encourage you to discuss this topic with your doctor. Ask them if they think that you have high breast density. Ask them for your last mammogram so that you can see if you have high breast density. Ask them to talk to you about your BI-RAD score. Make sure you are getting an annual mammogram if you're 40 or older. It's the only way, one, to determine if you have high breast density. It's also more likely that you catch your breast cancer earlier if you have breast cancer. And this increases your prognosis It reduces the amount of treatment you have to have, which also makes it less expensive, and it gives you a better life overall. I was very afraid of my exposure to radiation when getting my mammograms, and so I only had that one initial mammogram. My physician sent me an order to get a mammogram done about a year before I actually found that breast tumor. And I brushed it off because I didn't want to expose myself to radiation. Here's the thing, mammograms do not expose you to very much radiation. The amount of radiation you get exposed to by a mammogram isn't much different than 2 months of just existing. So this is consideration number 7. More people die of breast cancer gone undetected than from exposure to annual screening mammograms. The statistic is at least 30% lower breast cancer mortality through routine mammograms. I often wonder if I would have caught my breast cancer earlier had I started getting more routine mammograms once my general physician started ordering them. Consideration number 8 is that you can't forego your mammogram and just have an ultrasound. It doesn't work that way. Ultrasounds are meant to be done in conjunction with mammograms. I know it would be nice to avoid any exposure to radiation possible. Not to mention, you wouldn't have to have your boobs flattened like pancakes. Some things have only been identified by a mammogram when compared to an ultrasound. Ultrasounds aren't as reliable because they vary by the skill of the technician. Mammograms are currently the most effective tool for screening breast cancer. Mammograms have more consistent protocols and standards compared to ultrasounds. And mammogram technology is continuing to improve. For example, 3D mammograms help pick up issues with breast density that regular mammograms don't. But don't completely write off ultrasounds either. They are helpful in diagnostics as a supplement to mammograms. They're used to further evaluate a suspicious spot. They're used to help target a biopsy. They're used to help your care team write a better care plan out for you. So what does breast cancer actually look like on an ultrasound? One radiologist described it as a scary storm cloud. Ultrasounds are images produced by sound waves, usually in variations of blacks, whites, and grays. Breast cancer usually shows lumps that are taller more than they're wide, but they can appear lumpy or round or oval shaped, and they tend to have scribbled edges. When an ultrasound tech finds breast cancer on an ultrasound, they tend to find it because the breast cancer tends to block sound waves, which makes it difficult for the tech to see what's underneath that area.
The last consideration, or the 10th one, that I have to leave with you is to be cautious with thermographies. They're touted as painless infrared screening tests that are more comfortable, less invasive, and have lower radiation risk when compared to mammograms. But it's not a replacement for a mammogram. It's not a standalone test. It's only cleared to be used alongside a primary test like a mammogram. Research shows that thermography can make a big difference, but only in conjunction with other screening, especially mammograms. Thermography reports do not tell you whether you have an illness, disease, or other condition. Thermography is thermal imaging. It detects temperature and blood flow. It can also be used as an add-on to mammos, but it's not suggested as an alternative. Some claim that rapid growth and multiplication of cancer cells increases blood flow and metabolism, which leads to higher temperatures in these areas, and that thermography can detect this. Now, thermography may monitor abnormal processes in the breast. It may identify risk factors that could contribute to developing breast cancer. It may detect vascular changes in the breasts. The risks of relying only on thermography, though, result in higher rates of inaccurate results.
You're never told that life could ever get this way. This bill's a joke, you're broke, your love life's steal weight. This journey feels like you're in second gear, where it hasn't been your day, your week, your month, or even your